What are your experience in diagnosis with non-invasive prenatal testing?
Okay, so we've in Leuven we've developed a technology which was clinically implemented in 2013, and since then we have done over 20,000 analyses for non-invasive prenatal tests. Yes, so it's as of July 1st, all women in Belgium will be reimbursed for the non-invasive prenatal test. So I think it's an example of where genomics has been rapidly integrated in current healthcare.
And what is the success rate of non-invasive prenatal testing?
99% of the women get a result after the first test. Sometimes 1% of the women we have to resample and they get then a result. And then in terms of accuracy, so we have thus far no false negatives for trisomy 21. 13, we had two false negatives for trisomy 18. So that's where we missed a diagnosis. But that's a very small number. Sometimes you see false positives, which are actually caused by biological reasons because we have mosaicisms. There's a difference, sometimes a different genetic constitution between the placenta and the fetus, and therefore we always ask for invasive.
And improving pregnancy management, what are the challenges for genetic counseling?
Especially for non-invasive testing, I think the counseling is a little bit important before, although that's diminishing because the test is offered for all pregnant women, but I think their society has to educate the woman what it means to be tested, and I think that's sometimes missed and their genetic counselors have a task. But post-test analysis and counseling is extremely important for those cases where there's an abnormal result, to release anxiety and also discuss the options with the parents. One option is of course interruption, but that's not the only option. You can then be preparing for a baby with Down syndrome or another genetic disorder.